How am I going to recognize the epigastric pain of reflux disease? How am I going to recognize that epigastric pain of reflux disease as different from the epigastric pain of the others? 32-year-old man comes to the emergency department for substernal pain. Well, that's the first big difference. The other big difference is that epigastric pain that goes up into my sternum is different from the other forms of epigastric pain. Reflux disease follows the pattern of acid as it goes up under your sternum. The other thing is it hits the back of your throat and causes a sore throat as it hits the back of your throat. The others don't cause sore throat. The others don't have pain up here. You don't have ulcer disease, gastritis, or cancer, or pancreatitis causing you pain up here in your throat. You don't have ulcer disease, or gastritis causing you to have hoarseness as it goes around and hits your vocal cord. A bad taste in your mouth. Ever put a handful of pennies? Put your change in your pocket. That's what it tastes like. Reach into the pocket, put a handful of change. Nickels. Put a handful of change in your pocket, and that's what the acid tastes like from reflux disease. Acid tastes from reflux disease. Metal tastes like a handful of copper pennies. Lincoln. Therefore, metallic taste, bad taste. The glossopharyngeal nerve on the back of the tongue. The glossopharyngeal nerve on the back of the tongue provides taste receptors. Taste receptors on the back of the tongue. Okay? Now, the other thing is it makes you cough, because as that acid does a U-turn in your throat, it hits the back of your throat, sore throat. Curving around, hitting those taste receptors on the back of the tongue. Hitting the taste receptors on the back of the tongue, giving you that metal taste. Oh, going down there, we're hitting the vocal cords. Hoarseness. Oh, what are we going next? Because I'm causing hoarseness, laryngitis. It's like a virus, but it never goes away. Going through those vocal cords and diving for the carina. Hit the carina. Hit the carina. Hit the carina. Going past the carina, going past the carina, and I'm wheezing. Safe. And we're in your lung causing respiratory symptoms that we didn't have with anything else. Because the hoarseness is when it curves around, hits the vocal cords. The cough is when it hits the carina, and the wheezing is when it hits the lungs itself, and the acid in your lungs, not good. So that's what's different about reflux disease from the other things. Now it depends on what the question says. If the question says, I have a 38-year-old video camera operator who's got epigastric discomfort and it goes sore throat and epigastric discomfort and substernal burning. I got a 32-year-old, 28-year-old video camera recorder who's got himself some burning in here and some epigastric discomfort going up into his chest and a sore throat. The next best step is not the same thing as what's the most accurate test. The next best step is to go straight to treatment. The next best step, if you've got all this, is to go straight to treatment. The next best step, what do I need a 24-hour pH monitoring for? Look at this. I got a guy with epigastric pain, substernal pain, bad taste, and sore throat. That's enough. Go straight to treatment. The next best step, straight to treatment. The next best step, only if it's very mild and intermittent. Only if it's very mild and intermittent do we use H2 blockers. H2 blockers are not as effective as a proton pump inhibitor. Anybody that has either moderate disease or persistent, if it is moderate disease, meaning it really bothers him, or it's persistent, moderate or persistent, then it is proton pump inhibitors. Moderate or persistent gets proton pump inhibitors. Moderate or persistent gets proton pump inhibitors. Only the most mild intermittent symptoms, H2 blockers and lifestyle modifications. Now these are also lifestyle modifications, but what's a lifestyle modification for your esophagus? What lowers the lower esophageal sphincter pressure? Lowers the lowest? Why don't we say decreases? What decreases the lower esophageal sphincter pressure? What makes it so the acid will come up? What makes it so that that sphincter pressure is diminished and the acid is more easily able to reflux up? Well, the French in their post-dinner treats were absolutely right. Well, let's have a little sambuca and a cigarette, some chocolate, some nicotine, alcohol, caffeine, and chocolate. Nicotine, alcohol, caffeine, and chocolate. What did the French know 200 years ago? Is that having a little sambuca after dinner is the thing that's supposed to increase forward flow of gastric motility. It increases gastrin release, it increases motilin release, which is a nice thing if you're sitting around having just stuffed yourself at a restaurant. It increases forward motility. But the problem is it also decreases the sphincter pressure and acid comes up. So all the things that lower the sphincter pressure, nicotine, cigarettes, alcohol, caffeine, chocolate, peppermint. Why do you think those dinner mints are there on the way out? That's what the peppermint is for. It's to increase that GI motility because people knew intrinsically themselves a long time ago, peppermint increased forward flow of GI motility. Now, I think that in the future, what they'll have in that little dish as you go out the restaurant will no longer be mints and peppermint and the little seeds you take out with the spoon. What we're going to have is we're going to have proton pump inhibitors and Lipitor. So instead of grabbing a peppermint or a candy on the way out the door, or fortune cookies with an orange, what they're going to give you is they're going to give you a hit of omeprazole and a statin like Lipitor to lower your cholesterol at the same time. Please look for this in my all-you-can-eat simultaneous liposuction Italian restaurants. All-you-can-eat Italian with simultaneous liposuction. Take this as a proton pump inhibitor after dinner instead of the peppermint. The peppermint lowers the sphincter pressure. That's good if you want to increase motility. It's bad if you suffer from reflux symptoms. No nicotine, alcohol, caffeine, or chocolate. Lift up the bed so the man slides off. Okay? Head of the bed, 8 inches up, 6 to 8 inches. So you're supposed to be lying on an inclined plane so that the acid stays in your stomach. But remember, just 6 or 8 inches. All those people who say in class, in the live class, what people say, put it up at 45 degrees. 45 degrees is a little bit too steep. You'll slide off. 6 inches is just to keep the acid in the stomach. Keep the acid in the stomach. Don't sleep upside down. No nicotine, alcohol, caffeine, or chocolate. No nicotine, alcohol, caffeine, or chocolate. H2 blockers is only for the most mild intermittent symptoms. If it's moderate or persistent symptoms, proton pump inhibitors and lifestyle modifications. Now, the other thing is, what is the most accurate diagnostic test? 24-hour pH monitoring. What is the most accurate diagnostic test? 24-hour pH monitoring is the most accurate. I didn't say that you do it, but it is the most accurate test. In this guy, you don't need to do it. 28-year-old video camera operator, oh, I got some pain in here. It goes up into my chest. It feels burning. And I got this crappy taste that feels like I just gargled with pennies. Go straight to therapy. What do you do if the symptoms persist despite that initial therapy? If the symptoms persist despite this initial therapy, that's when we do surgery. The medications didn't work. Well, the medication should work in 90 to 95% of patients. The medication should work in 90 to 95% of patients, and if in that 5 to 10% of patients in whom the medications don't work, in the 5 to 10% of patients in whom the medications don't work, we do surgery. Now, the surgery could be a Nissen fundoplication. The surgery could be, let's put a purse string suture around your lower esophagus. Oh, that sphincter is too loose. Let's put a suture around it. Yep. Oh, I'm feeling better. Yep. Oh, I'm feeling better. Oh, the acid is staying where it belongs. Put a suture around your lower esophageal sphincter the same way as a belt around your waist. Let's put a belt around it. Zip. Tighten up that sphincter and you're going to feel much better, and I will too. So, surgery is for the 5 to 10% of patients who don't get better with proton pump inhibitors. Lifestyle modifications, no nicotine, alcohol, caffeine, or chocolate. Oh, Dr. Fisher, you know lifestyle modifications don't work. Let's just take some pills. I know, but you're supposed to try anyway. It's the same with high blood pressure, sodium restriction, weight loss, exercise. Put the cheeseburger down. Just put the cheeseburger down. Put your hands in the air. Step away from the counter. Put the cheeseburger down. You're supposed to do that anywhere. No more crispy chicken for you. Only broccoli from now on. Oh, you know that nobody keeps to these lifestyle modifications. Where's the French fries? Where's the French fries? I got to have ketchup with my French fries. Where's my salty French fries and my salty ketchup? This relationship is based on salty French fries and salty ketchup. Lifestyle modifications. Even if people won't adhere to it, you always say it. No nicotine, alcohol, caffeine, or chocolate. Hypertension, weight loss, exercise, sodium reduction, relaxation methods, and dietary modifications. Put the cheeseburger down and put the broccoli in. The same with diabetes. Exercise, weight loss, diet control. It's the same concept. Now, 24-hour pH monitoring is rarely necessary because the diagnosis is more obvious. But if the diagnosis is not obvious, then we have to do that 24-hour pH monitoring. When you see the test there called the Bernstein test, now I feel bad for old Bernstein and his test, but it will be always wrong. This is the wrong answer. The Bernstein test was taking a catheter and putting it into your esophagus and dripping acid in your esophagus to see if it burnt you, to see if it simulated the pain. It's always wrong. It's archaeologic. Okay? It's always wrong. 13th century Spain, Torquemada, Inquisition. Do you recant? No, no, no. Do the Bernstein test. Put the catheter in and drip the hydrochloric acid. Do you recant? No, no. Bernstein test will be there, but it'll be the wrong answer. Some of you may have been told that if you want to simulate the symptoms of reflux disease, drip acid and it'll simulate the symptoms, but it is now in the Department of Medical Archaeology at the Smithsonian Institute next to the pneumoencephalogram, chloramphenicol, and my virginity.